Austin's news station. This is KVUE News Midday.
It is no secret, most men do not like going to the doctor, especially for routine exams, but that can be a deadly mistake. Prostate cancer is the leading cause of cancer death in men. Dr. Koushik Shaw is a urologist at Austin Diagnostic Clinic, and he's here to talk about the importance of these screenings. Good midday.
Good midday to you.
Good to have you here. I know as a married woman, men do not like to go to the doctor. Why do you think that is? It's so tough to get them to go for those routine exams.
Yeah, I think men in general tend to be in a little bit of denial, especially when it comes to their health, and it often takes somebody in their lives to actually drag them to the hospital kicking and screaming. Same thing with prostate cancer, especially in prostate cancer screening. The signs and symptoms are so silent, it actually decreases their perceived need to come and see a doctor.
Interesting. Okay, so for women who are usually the ones to get their loved ones to the doctor, let us know what exactly is the function of the prostate, and as you said, there are no symptoms. What do we look for?
Well, men will joke that the prostate is just really there to cause them trouble, but it is a sexual organ. It lives just below the bladder and is part of the urinary system, and it is a reproductive organ. What happens as a man ages, however, it does two things. Number one, it tends to grow, which can sometimes cause lower urinary tract symptoms in terms of urinary urgency, frequency, pushing and straining to urinate, getting up at night to urinate. However, there's a separate issue, and that's prostate cancer, which can be independent of those symptoms, and the rates of prostate cancer tend to grow with age. Now,
this is curable, but if it's caught early, and that's, I guess, the key right here, the screenings.
Yeah, and the great thing about prostate cancer is that it is a slow-growing tumor, and it can easily be treatable if it is caught early, and that's why we're trying to get the word out, especially this month.
Now, these screenings are pretty effective?
The screenings are and that's what they really are, is a screening tool, but it really allows us to, number one, get a simple blood test, which is called a PSA, and second is a digital rectal exam. Between the two, it gives the urologist a better understanding of who we need to potentially do a prostate biopsy on to see if they have prostate cancer.
Are there people who are more at risk than others? For instance, women with breast cancer, some are at greater risk than others?
Yeah, great question, Melissa. There are two populations that we especially want to get the word out to. Number one is African American males. Although most patients need to be screened at the beginning at the age of 50 yearly, we actually advocate that patients that are African American or have a first-degree relative with prostate cancer, that they actually be screened at the age of 40 years.
A little bit earlier.
Correct.
Tell us about the treatments, because there have been all kinds of new breakthroughs.
Absolutely, and the treatments vary depending on the age, medical history, and general well-being of the patient that we've detected, as well as grade and stage of prostate cancer. And the wonderful thing that I tell about my patients is that, especially if you are caught early, I can offer you a real host of treatments based on who you are. This includes watchful waiting for low-grade cancers, hormonal treatments. There is something called cryotherapy, which is to freeze the prostate. There is surgical management, which is now often done laparoscopically via robotic technique. There is radiation therapy. So there's a host of treatment options, which is often, again, curable for low-stage, early diagnosed prostate cancer.
And that is the good news in all this.
Absolutely.
So we just have to get our men to the doctor.
Absolutely. Starts there.
Thanks a lot, Dr. Shaw.
Thank you very much.
Appreciate it.